Your Medicare premium is not a fixed number. It can be raised at any point without a vote, without a phone call warning you, and without any mistake on your part, based entirely on income you earned 2 years ago and have almost certainly already spent. That's not a hypothetical. It's happening right now to roughly 7 million Americans on fixed incomes, most of them with no idea this mechanism existed until a notice arrived telling them their premium had changed. By then, the money was already leaving their check. My name is Walter. I'm a state bar licensed estate attorney, and I've spent more than 15 years sitting across the table from families who walked into exactly this kind of discovery, not because they were warned, but because they opened the wrong envelope on the wrong morning. Today, I want to walk you through 3 specific things that are quietly pulling money away from seniors right now, not someday, right now. The first involves a Medicare rule that can add hundreds of dollars a month to your premium based on a single financial decision you made 2 years ago, and an appeal process that almost nobody files. The second involves a law that passed earlier this year, a law that entitles certain retirees to real money sitting in a government processing queue right now, with no one calling to deliver it. And the third one I'm going to make you wait for because it's the one that gets to me most. It's the quietest, it affects the most people, and nobody seems to talk about it. Hold on to it. Before I get into the first one, let me answer the question already forming in your head. If this were really affecting that many people, wouldn't you have already heard about it? That's a fair question, and the honest answer comes down to one thing. None of the agencies involved have any real incentive to come find you and explain any of this. The government doesn't call seniors to say a check with their name is waiting. The Medicare billing system doesn't flag your account and explain that a surcharge is contestable. The silence isn't a conspiracy. It's just the way systems work when no one's job depends on your knowing. My job is simple. I read the fine print and I tell you in plain English what I find. Let me start with the first thing. The word is IRMAA, Income-Related Monthly Adjustment Amount. In plain English, it's a Medicare surcharge. If your income crossed a certain threshold 2 years ago, you are paying more for Medicare Part B right now than the standard amount, and that higher rate runs for the full calendar year. The standard Part B premium in 2025 is $185 a month. At the first IRMAA tier, individual income between $106,000 and $133,000 based on your 2023 tax return, your premium jumps to $259. That's an extra $74 every single month. At the second tier, $370, double the standard rate. At higher income levels, the premium can reach $628.90 a month. For a couple where both people are on Medicare and even the first tier applies, that's more than $1,600 in extra premiums every year for something that may have happened only once. And here's the part that catches people completely off guard every time. IRMAA doesn't care whether your income was high because you earned it steadily over decades or because one thing happened once. Sell a home you've lived in for 30 years. Take a large required minimum distribution from a retirement account to help a family member through a hard year. Receive a lump sum payout from an inherited IRA. Any one of those can push your income over the threshold in a single year, and Medicare uses your tax return from 2 years prior to set your premium today. The income is gone. The event is over. But the surcharge keeps coming out of your check every month until December, whether or not that income ever comes back. Let me put a face on it. I'll call her Eleanor. Eleanor is 72. Her husband passed away 3 years ago, and she sold the home they'd shared for 36 years shortly after. It was too large to manage alone, and the sale gave her enough to move somewhere smaller. It was the right decision. What she didn't know is that the sale pushed her income, just for that 1 year, above the IRMAA threshold. No one called to explain what that meant. This January, she opened her Medicare notice and found her Part B premium had nearly doubled. She read it 3 times. She called her son. Neither of them understood how it had happened, and both assumed there was nothing to do. Eleanor has been paying that extra charge every month since, quietly, out of a Social Security check that wasn't large to begin with. Here's what Eleanor didn't know. There is an appeal. It's called a life-changing event reconsideration, and you file it using Form SSA-44. If the income that triggered your IRMAA surcharge came from something that won't recur, a home sale, a one-time IRA distribution, a death in the family that changed your filing status, you can ask Social Security to use more recent income figures instead of the 2-year look-back. If approved, your surcharge is adjusted or removed for the remainder of the year. The process is not difficult. The form exists specifically for this situation, but you have to know to ask, and you have to file before the year ends. For every Eleanor who doesn't know the form exists, that money leaves her pocket every month with nothing to show for it. If you received a Medicare premium increase this year and had a one-time income event in 2023, call Social Security at 1-800-7722-1213. Ask specifically about Form SSA-44 and a life-changing event reconsideration. Don't wait until December. One thing I'll say clearly before moving on: Social Security will not call you to offer to reduce your IRMAA surcharge for a fee. They will not ask for your bank information to process a refund. If someone contacts you using this vocabulary and asks for payment or account numbers, that's a thief, not a government representative. The real appeal is free. It starts with a call you initiate on your own terms. Now let me bring you to the second thing, because this one runs in the opposite direction. Instead of money being taken out, this is about money that's already calculated and sitting in a government processing queue with some people's names on it right now while they go about their day not knowing it's there. In January 2025, the Social Security Fairness Act was signed into law. It eliminated two provisions that had quietly cut Social Security benefits for millions of Americans for more than 40 years. The first, the windfall elimination provision, reduced Social Security benefits for people who also received a pension from a job where they didn't pay into Social Security. The second, the government pension offset, reduced spousal and survivor benefits for the same group: teachers, firefighters, police officers, state and county government employees. If you spent years in a job where your employer paid into a pension instead of Social Security, and you also have Social Security credits from other work, one or both of these provisions may have been reducing your monthly benefit, possibly for years. And as of January 2025, that reduction is supposed to stop. The law also requires SSA to pay the retroactive difference going back to January of this year in a lump sum back payment. For some people, that back payment is several $100s. For others, it's several thousand. The SSA has been sending letters and processing accounts in batches. But here's what nobody's talking about: the agency is behind. Not every affected person has received their recalculation. And for anyone whose contact information isn't current with Social Security, a moved address, a changed phone number, a check issued to the wrong record gets returned, and the burden of chasing it down falls entirely on the person who was owed it. I'll call him Tom. Tom is 74. He spent 21 years as a county public works supervisor, then worked another 9 years in private construction. Social Security credits from both periods. He'd heard something about a law change, but figured the government would sort it out and send a letter when the time came. He hasn't logged into his My Social Security account in over a year. His address changed when he moved 14 months ago. He updated his bank, his insurance, not Social Security. Right now, Tom is likely owed somewhere between $2,000 and $4,000 in back payments pointed at an address where he no longer lives. If you worked a public service job and also have Social Security credits, or if your spouse did, because the government pension offset repeal also affects spousal and survivor benefits. Here's what you need to do right now. Log into your My Social Security account at ssa.gov and verify that your mailing address and direct deposit information are exactly current. Then look at your benefit amount. If it hasn't increased since January 2025 and you believe you were affected by either provision, call SSA at 1-800-772-1213 and ask directly whether your account has been flagged for recalculation under the Social Security Fairness Act. Calling puts you on record. Don't assume no change means the change is coming on its own. I want to pause here because I've given you two things with real windows. One appeal that closes at year end, and one back payment that depends on your information being correct right now. Write both of those down. For everyone who wants all of this organized in one place, the exact form numbers, the language to use when you call, the step sequence for each situation, I put together a plain English guide covering everything on this channel, including both of these. It's in the description below. Take a look after the video. Now, the third thing, the one I told you I was saving. In every state in this country, there is a set of programs funded through Medicaid that will pay your Medicare Part B premium for you, not reduce it, pay it entirely. The primary program is called the Qualified Medicare Beneficiary Program, or QMB. If you qualify, the state pays your Part B premium, $185 a month in 2025, more than $2,200 a year, and in most states, covers your deductibles, co-payments, and coinsurance on top of that. The meter on your out-of-pocket Medicare costs stops. There's also a program called SLMB for people with income slightly above the QMB limit, which covers the Part B premium. And there's a federal program called Extra Help that caps your prescription drug costs under Medicare Part D. Most covered generics at $4.50 per fill, most brand name drugs at $11.20. For someone managing multiple prescriptions, that difference isn't minor. That's the difference between filling every prescription on time and having to choose which one to skip this month. Now I know what some of you are thinking right now. Walter, I probably make too much to qualify for any of this. I want to address that directly because it's the single most common reason people never apply. Don't make that calculation at your kitchen table. Let the actual income limits do it. For QMB in 2025, the individual monthly income limit is approximately $1,255 for a couple, roughly $1,704. These numbers vary slightly by state, but the point is, these programs are designed for people living on Social Security and modest pension income, and the asset limits people worry about exclude your home, one vehicle, and burial funds. Most people who've ruled themselves out without applying were wrong to do it. Let that land for a moment. Let me put a face on it. I'll call her Margaret. Margaret is 73. Her Social Security check is $1,347 a month, no other regular income. She's been cutting back on everything she can find. Grocery trips, heating in the back rooms, which prescriptions to delay until next month. She assumed years ago that she made too much for any kind of assistance and never looked into it. Because Medicare deducts the Part B premium from Social Security before the check arrives, she's never even seen that $185 as a line item. It was just gone before the money reached her. If someone had told Margaret about QMB 2 years ago, she'd have had her premium covered and her prescription costs cut dramatically every month since. More than $2,200 a year in premium alone before drug savings, no new law needed, no new program. The program was already there, sitting, waiting with her name potentially on it, and no one whose job it was to tell her ever did. Here's what to do. Contact your state's Medicaid office to apply for Medicare savings programs. If you're not sure where to start, call your State Health Insurance Assistance Program, SHIPE, which offers free counseling with trained advisors available in every state. Find your state's SHIP program at shiphelp.org. The Extra Help application goes directly through Social Security at ssa.gov or by calling 1-800-77-21213. And don't let an assumption disqualify you before the form does. That's the form's job, not yours. Now let me pull the picture back. 3 things are quietly moving money right now. A Medicare surcharge triggered by a single pass financial event with an appeal that almost nobody files, even though most people who do file it win it. A 2025 law requiring retroactive back payments to public service retirees that won't arrive if your contact information isn't current. And a set of state programs that will pay your Medicare premium entirely, with an estimated 3 to 4 million eligible seniors not enrolled, not because they don't qualify, but because no one ever told them to look. Add those together for the right person, and you're looking at more than $5,000 a year, all from programs and rights that already exist and simply aren't being claimed. The system counts on a certain percentage of people never starting. Every person who doesn't start represents money that stays in a budget instead of going where it belongs. You already did the first step. You watched this video. That's not nothing. So here's what I want to leave with you, and I genuinely like your answer in the comments. Out of these 3, the IRMAA appeal, the Fairness Act back payment, and the Medicare savings programs, which one did you actually know about before today? And if the answer is none of them, what does that tell you about how much might still be out there that no one has gotten around to mentioning yet? If you know someone over 65 on a fixed income, a parent, a neighbor, someone from your church, send them this video. Not because I asked you to, because there's a real chance they're in one of these 3 situations right now and have no idea. Thank you for the time you spent here today. In the next video, I'm going into something very few people address directly: what actually happens to your Social Security benefit when you keep working past your full retirement age, and why one specific timing decision made in the wrong year can permanently change the amount you receive for the rest of your life. Most people think they already know this one. I'd be careful about that assumption. I'll see you there.